Hey, how's it going? Today we're going to be answering a question that many people have asked, and that's probably why you found this video. I'm Dr. Tyler Williams at Pinecrest Dental, and the question that we're going to answer and discuss is gum disease. And what is gum disease? How do I get gum disease? How do I get rid of gum disease? Is this something that's contagious? Is this going to cause me to need root canals? Lots of great questions. The first thing to know is gum disease is very common. So if you have gum disease, unfortunately, you're not alone. Half of adults in the U.S. have gum disease. That's pretty consistent in other countries as well outside the U.S. If you're 65 or older, there's a 2/3 chance you have gum disease, which means that goes even higher now. 2/3 of our population that's over 65 have gum disease. It is the leading cause of tooth loss in adults. Gum disease is contagious in some forms, and there's different levels of gum disease. As you can see in the picture here on this video, there are 5 stages of gum disease. And if 0 is healthy, which is less than half of adults, then you go stage 1, which is gingivitis. That's where your gums start to bleed easily. You may start to notice some bad breath or sensitivity, or when you're brushing or flossing, or you have lots of buildup behind your teeth. And stage 1 is the only completely reversible stage. So if you're in stage 1, we can treat it. We use a special ultrasonic water jet and a laser and some other things that really work well. It's very comfortable, very minor treatment. But it does require some follow-up and some commitment from you to do some things at home. So if you're willing to commit to those things, we can help you get fresher breath, get rid of the yellowing and the staining on your teeth, help you get rid of that stage 1 gum disease. Stages 2, 3, 4, unfortunately, are not completely reversible. Now we can stabilize it, get it healthy, get rid of the bleeding, the bacteria, the infection, but any bone loss you have or any gum receding that you get, unfortunately, will not come back. Now, if it's minor or moderate, small to medium level, most of the time we can stabilize it. You can have a good quality of life, still have a nice smile, and just keep you on a good maintenance program, give you some more tools to use at home. Stage 5, that's when you lose teeth. That's when they become too loose. You get deep pockets, which means that if you could slip something between your tooth and your gum, that's called a pocket. And your toothbrush can't get in there, your floss can't get in there, your water pick can't even get in there more than maybe a 1 to 3. But when you get to stage 5, usually you have a 7, 8, 9, 10 deep pockets in there. Those are very bad. There's millions and even billions, that's right, billions with a B, of bad bacteria. Those bacteria can be transmitted to your partner, your spouse, okay? Sharing a glass, kissing, those kind of things can cause the bacteria to jump. So if you're being treated for gum disease, you should also make sure your partner gets a gum health assessment, consultation, figure out if they have something going on too. Now, gum disease is not the same as tooth disease. Tooth disease would be things you would think of as fillings, cavities, cracked teeth, crowns, root canals. Those are inside your tooth. Those are problems as well. Those are bacteria problems. But gum disease happens around your teeth. So we treat a lot of people that have gum disease. They don't even know they have it because it's often only minor sensitivity, not a lot of pain. It's kind of like diabetes, where it's a chronic disease. Sometimes it onsets slowly. You can't always see it, but it causes other problems. It causes blood sugar issues. It's linked to heart attacks, strokes, dementia, and even cancer now. And most of all, it can increase your other medical expenses outside of your mouth. So it really pays to get that taken care of. And we know with our patients who have healthy gums, they typically have whiter teeth, whiter smiles, healthier smiles, less shifting of teeth. It doesn't hurt when they floss or brush. It does take some time to get it under control. We're happy to go over some options with you if you're a candidate for our gum therapy, which is usually 85 to 95% successful. And if it's one that's not going to be successful, we can generally tell you up front. Now, if it's not going to be successful, then sometimes maybe we'll recommend implants or bridges or braces or something else, but treating your gum disease is a great way to go. A lot of places are promoting full mouth implants. Get rid of your teeth, get implants. We know that is not the best option for most people. You'll save time, money, pain, time away from work and family if you treat your gum disease. Do a couple more things at home outside of brushing and flossing, which unfortunately is no longer enough. And that'll give you a nice healthy smile that'll last for years to come. So give us a call or click with questions you have. And if you mention this video, this month only, we're offering a free gum health assessment and a whitening pen. So when you come to get your no obligation gum health assessment, you get a whitening pen. Now the gum health assessment doesn't include x-rays and all the other things that you may need, but with the gum health assessment, you'll at least know what to expect. You can get an estimate of cost and time and what's involved, and then we'll give you this cool whitening pen that will help touch up and brighten your smile. So look forward to seeing you, and we'll be able to answer any other questions you have. Talk to you soon. Thanks.